Good evening, everyone. My name is Danny Banks, Director of Public Safety for Orange County, Florida, and it's my privilege to welcome you here tonight. Tonight's meeting, a very important public health and safety forum for our community. We're here, as you know, to talk about vaping. It's a national problem. It's certainly a problem in our state, and what's important is our recognition that that's a problem for us to address and discuss in Orange County. Keeping with the spirit of Mayor Demings, and you'll have the opportunity to hear from him in just a few minutes, but Mayor Demings' focus on public health and safety in Orange County specifically, that's one of his top initiatives of his term as mayor of our county. So that's a strong focus for us in Orange County. We're privileged to have participation of one of our primary children's healthcare hospitals here in Central Florida tonight, Nemours Children's Hospital, and some great panelists to have a discussion with us tonight on vaping and its product and its effect to our community. So thank you all for being here. Tonight, again, as I'll bring up to you, I want to introduce you Mayor Jerry Demings to open our topic tonight. He's got some great words of encouragement for us to challenge us to really think outside the envelope on this issue, really respect what the information, where it leads us to, and where we can do better as a community to keep our community and, more importantly, our children safe. So please join me in welcoming our mayor, Jerry Demings. Thank you, sir.
Thank you, Director Banks, for the introduction and for kicking us off here tonight. Let me welcome all of you here to the Orange County Board of County Commissioners chambers. We're looking forward to a great discussion tonight. And let me begin by thanking our healthcare providers for being here and being tremendous partners in this community forum. I also want to thank Mr. Matt Lipoli with WESH and the Orange County Department of Health students working against tobacco for their partnership. It's always good to have our youth engaged in the solutions. I'd also like to recognize Dr. Tom Hall, the director of the county's drug-free office, for coordinating tonight's program. Thank you, Dr. Hall. This is a timely discussion, as you will hear from experts on the health-related consequences of vaping and what parents, family members, and youth can do in response to this growing trend that we're seeing across the nation. In fact, in 2018, the CDC and FDA data showed that more than 3.6 million youth in the U.S. were past month e-cigarette users. 3.6 million youth across America. This breaks down to 1 in 5 high school students and 1 in 20 middle school students. If you're like me, this is troubling since I now have grandchildren who are within that particular age group. And so we are trying to do our very best to ensure that we try to contain this growth in the use of nicotine by vaping throughout America, and certainly here within this community. As a parent and as a grandparent, I know the importance of talking with your children early and often about the consequences of drug use. I would encourage you to start that conversation because it's really never too late. A message for our youth, physicians, and parents are credible sources of information, and when you talk about drug use, they hear you, they understand you, they want you to help them. Again, I thank all of you for being here tonight as we delve into this issue more directly within Orange County and throughout the Central Florida area. I'm certain that these young people who are on program tonight will make it real for all of us. And so I, unfortunately, will not be able to stay for the duration of the discussion tonight. We have another town hall meeting. I have a transportation initiative that I'm working with municipalities, and so I'm going to be speaking to the Maitland City Council tonight about some of the transportation solutions that we are advancing here within Orange County. So again, to all of the program participants, thank you for being here.
Thank you, Mayor Demings. So What is most important about a public forum is you have interaction. You have a lot of discussion. You have people certainly with subject matter expertise and get a lot of community engagement. And to do that, you have to have a great moderator. And we think we've done an exceptional job of doing that tonight. We've brought with us and asked him to be our guest in moderating tonight's discussion, Mr. Matt Lupoli with West TV2. Matt has been with the organization for several years, but importantly, he's both covered as a reporter and as an anchor some very high-profile, important topics to both community health and safety. So we're privileged to have him with us tonight. Matt, welcome. Thank you for being here. We look forward to you leading the discussion.
Thanks, everybody, and I'm here to welcome our wonderful guest panel here, starting with Shane and Chenille Lee Shaw. They're from Evans High School, and they are part of the Orange County Students Working Against Tobacco, SWAT. They're in the 11th grade, and if you notice a resemblance, they are twins. We're very happy to have them here tonight. Now we're going to welcome our medical professionals as well from Nemours. And starting with Dr. Floyd Livingston, he's the Division Chief of the Pediatric Pulmonary and Sleep Medicine for Nemours Children's Hospital. He has held the position for the last 20 years at Nemours and another 5 years at Arnold Palmer Hospital. Dr. Livingston holds the Professor of Pediatrics appointment at University of Central Florida College of Medicine and Associate Professor of Pediatrics appointment at Florida State University of Medicine as well. We're also welcoming tonight Dr. Lana P. Gordon. She received her Doctor of Pharmacy from Florida A&M University and her Doctor of Medicine from Morsani College of Medicine at University of South Florida. She completed her pediatrics residency at Arnold Palmer Hospital for Children and her fellowship in adolescent medicine at the Mount Sinai Hospital Adolescent Health Center. Dr. Gordon is currently the Associate Chief of Adolescent Medicine at Nemours Children's Hospital in Orlando. And Dr. Gift Kopsambut is faculty member of the Division Hospital Medicine at Nemours Children's Hospital in Orlando, and she has been since 2017. She completed her pediatric residency at Virginia Commonwealth University and earned her MD degree of University of Tennessee. She received her undergraduate degree with honors from Vanderbilt University, as well as an MS in Molecular Nutrition and International Health Policy from the Institute of Human Nutrition at Columbia University. Of course, we want to give everyone a very warm welcome here tonight. And now we're starting with a presentation from Dr. Lana Gordon, so she'll start us off.
Good evening, everyone. So I'm very excited that we're able to do this community vaping on community forum on vaping. And one of the things that's really important is one of the big questions that everybody has is vaping a new trend? Is it a fad, or is it something that is part of a consistent epidemic? And I would argue that it's actually going to be a little bit of a combination of the two. Sorry, I want to go ahead and go to our next two slides. Sorry, so that you can catch up with me. Perfect. Next one. Sorry, the one before that. There we go, perfect. So, with this image, one of the things that I think is really important for us to think about to frame our discussion this evening is that approximately anywhere between 2 million to 2.5, almost 3 million young people, are engaged in using some kind of substance. The most common substance being alcohol, but subsequently, definitely, tobacco, marijuana, and other products. But when you look at the number of young people that are also struggling with mental health concerns, the numbers are almost equivalent. So when we think about substance use, it's not just about as a youth trying out something to be cool or just to see what the latest thing is. It really is tied deeply to mental health, and that's why those numbers are so close. But we're here to talk about e-cigarettes, and what we know is that, congratulations, the use of tobacco in its traditional form, cigarettes, smoking tobacco, cigars, chewing tobacco, has gone down. However, what we know is that the trend of electronic cigarettes and other electronic nicotine delivering devices, or ENDs as we call them, those are going up. Boys are more likely than girls to use these substances. Families from more middle class affluent communities also are more likely to use these substances. And Florida is not any different from the rest of the country. In fact, our rate of e-cigarettes is actually higher than the national average, with about a third of young people at this point using these substances. So what is an e-cigarette, a vaping device, a Juul? We hear all of these terms thrown around. And the most important thing to realize is that we're talking about a battery, a heating element, and some kind of liquid. And so they can come in an all-in-one unit. Those are kind of the traditional disposable e-cigarettes. Those were the ones that we first saw. They can come in with a rechargeable battery. Juul is the most popular one that young people are using in that format. And they can come in these more futuristic models that we call mods or tanks. And that was very intentional for Big Tobacco. They needed a way to make this not a cigarette any longer because cigarettes have become extremely taboo. And so they needed it to look like something that doesn't necessarily look like a cigarette so that more young people can think that it's something that's an alternative. The liquid that's inside, it could be marijuana, it could be nicotine, it could be CBD oil, it could be water plus flavoring, or it could be any other drug substance. So these are some of the examples of just what they might look like. So you can see number 5 and 6 look very much like cigarettes, and so a family member or another adult may recognize quickly that that's an e-cigarette device. But when you look at number 4, that's the Juul, that's very popular. It looks very much like a USB flash drive. And then on the other ends, 9 through 11, as well as 1 through 3, those are what the tanks and the mods look like. So devices that you may not be sure what they are if you saw it in your teen's room. So the question is, are these items being marketed to teens? And when you think about it, I don't know, they claim that they're not marketing to teens, but when you look at that assortment of devices that look like candy, but those are actually flavoring for electronic devices, certainly looks like it's being marketed to children and teenagers. It's certainly not being marketed to adults. When you see images of young people who look like they're very, forward thinking and trendy and wearing, latest fashion, bright colors, again, seems like it's being marketed to teenagers and not adults. And then when you look at some of the flavor choices, that is why Juul became the most popular first for teens, because it came in a wide variety of flavors, like fruit and mango and creme and things like that would be appealing to a young person as opposed to an adult. So how much do these devices cost? And you can see that you can get a device as simple as $2 for a disposable e-cigarette. The tanks and mods are very expensive, and so those tend to be more popular amongst our young adults. But definitely you can get a Juul starter kit for anywhere between $40 to $60, and a lot of times when you go to the website, they'll offer you a discount where it's 50% off. So it doesn't take much for young people to get started with these products. Every 2 milliliters of the cartridges is equivalent to 1 full pack of cigarettes. So when you're buying these cartridges in 5 or 10 milliliter quantities, we're talking, 5 packs of cigarettes maybe that a young person is consuming. So when we think about marketing, 7 in 10 young people say that they have seen some kind of advertisement for an e-cigarette. Now, I know personally as an adult, I don't think I see advertisements for e-cigarettes that often. However, when we think about how marketing happens these days, it's very tailor-made to you, to what's happening in your life, to what you've clicked on previously, to what you're watching. So what that says is that when 7 in 10 teens that say that they have seen some kind of device that's marketing an e-cigarette, it means that they're going after places where young people would be looking, the magazines that they're frequenting, the shows that they're watching. And so while there may be fine print that says, you should not use these products if you're under 18, if we're placing at places that young people think that they might check out, then naturally that could happen there for sure. And so when you ask teens, well, what do they think is in their e-cigarette? 2/3 of them say it's just flavoring. Approximately 20% of them will tell you, oh, it has some kind of substance in it, nicotine or marijuana. And then another 20% are like, I'm not really sure what's in there. The reality is that no one's really sure what's in there because these liquids are not regulated in a way that we would know exactly what the contents in. They do not have to prove that they have what they say is in them is actually in there. And this is something that young people don't realize. In fact, when they've tested numerous cartridges that claim to just have liquid and flavoring in them, there is a significant proportion that actually do have nicotine also in there. So important for young people to understand that. So why has it become this epidemic? Why has it become such an issue for adolescents? Well, that comes from understanding the adolescent brain. So what I tell adolescents in my office is that your brain is divided into 2 parts, the lower brain and the upper brain. The lower brain is the happy dog brain. So if you think about a dog, dogs bark at whatever's passing by. So, they see their owner, they bark. They see another dog they don't like, they bark. They're just very reactionary. And that's what our lower brain does. It's all based upon emotion and memory of previous things that we've seen. And that's controlled by an area we call the amygdala and another area we call the hippocampus. Both of those parts of the brain are overrepresented in the adolescent brain. The top part of the brain, or the wise owl brain as I call it, is the part of the brain that allows you to think through what you're going to do and when you're going to do it. An owl could be sitting in a tree for hours, and you won't know the owl is there until the owl wants you to know it's there. And it's the same thing with the parietal lobe of our brain and the prefrontal cortex. That's the part of our brain that takes in information, analyzes it, and decides when it's best to use it. That's the part of the brain that's growing when you're a teenager. And so the two big times of growth of your brain is the first year of life, and then that decade and a half really, from 10 to 25. And so these substances are affecting that part of the brain. So anything that's tied to emotion, so I'm using the substance because I'm sad, I'm using it because I'm anxious, I'm using it because I want to have a good time with my friends, that lower part of the brain, the barking dog part of the brain, gets super excited when that's happening. And it then wants to fulfill that, so it becomes very quickly reinforced. Whereas the top part of the brain, the part that learns to delay gratification, doesn't have the same feedback to continue doing that. So when we talk about, well, why are e-cigarettes and vaping such a big deal for the adolescent brain, it's because it's more dangerous to the adolescent brain. Even a few instances of using it can actually stimulate that pathway to have that continue happening and for a teenager to go and use the substance over and over again. So even once or twice, infrequent use can be quite harmful. Additionally, teenagers have different responses to the substances that are in there, particularly the nicotine or marijuana, than you would in an adult. So it can worsen mental health. So they may be trying to use it because they want to calm down some anxiety or they want to lift their mood, but it actually could make depression worse. It can make anxiety worse. And so the takeaway point is that we're going to hear a lot about the physical effects from nicotine and from vaping, but we also want to remember the effects that it's having on the developing brain.
Dr. Lana Gordon, thank you so much for that portion of our presentation tonight. For the next part of the presentation, we want to go to Dr. Gift Copsambutton. Doctor, can you join us up here at the podium? Sure. Thank you so much.
So again, my name is Gift Copsambutton. I'm a hospitalist, and so you guys might wonder what a hospitalist is. I didn't really know until I went to medical school. It's basically a doctor that just works in the hospitals. I don't have a clinic. I just work in the hospital where I either get transfers in from outside hospitals or children who need to be hospitalized from the emergency room. Sometimes they don't know what the diagnosis is, and a lot of the patients that we got that end up being vaping adolescents came through that situation where we didn't actually know what was going on until a little bit later during their hospitalization. So this is a chart from the CDC that is showing the prevalence of vaping over the last couple months. There is a little time delay based on reporting, and that's kind of in the tail end of this chart here, and this was pulled in November, so you don't have the most recent data. Out in December, they decided to stop reporting the incidence of vaping in the outpatient setting. So now if you see the numbers go down, it's not necessarily because the vaping illness has gone down. It's more that we're just not reporting those numbers, and it's just the more serious cases that are in the hospital that we are reporting. So what are we seeing? So January 14th was the most recent report that came out from the CDC. So they acknowledged there were 2,668 cases, and this is all throughout the United States. Every single state has been affected, including Puerto Rico, and there have been 60 deaths. 77% of these hospitalizations were under 35 years old. So this is why it's important for us to try to target the adolescent population. So what are the substances that are in these e-cigarettes? So you're looking at both nicotine containing products and THC containing products. If you want to look at the graph at the bottom, you're looking at 83% of patients who are hospitalized with vaping used e-cigarettes that contain THC. So that's where the main focus of a lot of our interventions are. So what to look out for? I just wanted to mention in the meantime, the CDC is a great website. If you guys are looking for information, they always have the most up-to-date data and the recommendations. There are 4 specific recommendations from the CDC right now, and that if you don't vape, don't start vaping. If you are smoking cigarettes, don't go to a THC-containing cigarette to try to get off nicotine cigarettes. The other ones were don't use an e-cigarette that's been modified outside of the market of what's been marketed. So nothing that somebody has twisted the amps or volts or modified the e-liquid in, and then don't get an e-cigarette from a friend where you don't know where it's come from or what they could have put in it for you. So then what to look out for if you're a doctor or if you're a parent having a teen that you're concerned for vaping. So it remains a diagnosis of exclusion. So just because we say that, oh, you're vaping and you're having a cough, it doesn't mean that you have a vaping-related illness. So some of the things we want to ask are, what are your symptoms? So cough, shortness of breath, chest pain are prevalent in about 92 to 98% when they come and see us. The main point that I think was important was that a lot of the kids who came to see us first had GI symptoms. So they didn't even have the lung symptoms to begin with. The lung symptoms can present after the GI symptoms. So a lot of the GI symptoms we look at are diarrhea, abdominal pain, vomiting, and severe weight loss. So they can have weight loss up to 20, 25 pounds in the last 3 to 6 months that's unexplained. So a lot of these patients we're looking at, oh, do they have cancer? Do they have something else going on? And that's where a lot of our workup had come from. So then you also want to get the history of it's a typical adolescent history for us, but it's a little bit more specific. So you don't even just want to ask if it's e-cigarettes they've been using, but specifically, have they been vaping, have they been juuling, because sometimes they don't associate one term with the other, which is what we've seen. And then the other questions we ask is how often, because vaping once a day versus continually vaping for 4 hours a day, how many cartridges they go through a week. It's a differentiation that we want to know. And then what kind. So what brands are they using? What flavors are they using? It's known that adolescents are more likely to use fruit flavorings than mint flavorings or other tobacco flavorings, and there is legislation to try to get fruit flavorings off the market. And then we look for laboratory tests. So, a chest x-ray, which Dr. Livingston is going to go through a lot more detail, is interesting. It's not always going to show a vaping-related illness. And then some other labs as well. We look at inflammation because it looks like a lot of the chemicals that are involved in the e-cigarettes are creating system-wide inflammation, which may be what's causing the GI symptoms that we see. So then what we've seen in Nemours, we've had about 10 cases since spring that have come through my service. We had about 2/3 requiring some oxygen. We had a couple patients where we saw air coming out of the lungs. So you get these blebs called pneumothoraces and pneumomediastinums that we have to take care of. 3 with fluids in their lungs. And then what hasn't been in the literature, but we saw in our testing, we had 2 patients that we tested for blood clotting. That's important if they need chest tubes for air that's come out of their lungs. And they did have abnormal blood clotting as well, which can be seen in other substances like K2 and spice. So that's something that we're still looking into. I did go back and kind of look through these patients' charts, and after we kind of treat them, none of them have been rehospitalized for the same thing since. So that's at least good. So how do we treat these kids? So it's kind of based on their physical exam. So if they're having the diarrhea, stomach issues, we treat that. If they're having the lung issues, we focus on that. Sometimes they come in with both, so we kind of focus on everything. Antibiotics are not always indicated. A lot of times when you see some kind of haziness on the lung x-ray, you think it's a pneumonia, but it's not always the case. So you can't say that it looks like a pneumonia. They don't have a fever. Everything else doesn't look like pneumonia. They don't always need antibiotics. Steroids are the mainstay in therapy right now, which has been in the literature recently. There's not a standardized dosing, so we kind of base it on how the patient looks to us and how serious they are in the hospital. They may have to meet with multiple doctors, so my friends here are doctors that we consult out, and we include other doctors as well, like psychology, GI. We've consulted rheumatology, hematology, oncology based on what we see and what we're concerned for. The only other guideline and treatment right now is just to make sure that any patient you discharge are then in line with the flu and pneumococcal vaccine, especially if that they've had lung injury. You want to make sure that they don't get a second hit in the same season, if possible. So then when can we discharge them from the hospital? The most recent report in the last month said there was a few deaths that were reported within 24 or 48 hours of discharge from the hospital previously. So now they're recommending that once kids are, at least off oxygen, that we watch them for another 24 to 48 hours to make sure there's not a secondary decompensation. And then it's suggested that they have an outpatient visit and to set up within the next 24 to 48 hours, and then to set up with pulmonology for follow-up for long-term care within the next 2 to 4 weeks if pulmonology has not already seen them in the hospital. And then most importantly, I think that what Dr. Gordon had already emphasized, access to mental health and substance use services, and then a quit plan. So what we do see is the vomiting. So one thing that we've noticed is cannabinoid hyperemesis syndrome. So if you've been using marijuana for a prolonged period of time, you can actually get vomiting just from chronic use of marijuana. So usually it goes away once they stop marijuana for usually 48 to 72 hours. They get better, they think we fixed them, they go back and they start smoking marijuana again, and it starts up all over again. So they can be diagnosed with an alternative diagnosis, but this is what it is. It's actually relieved by hot showers. So a lot of these patients, they'll be reported to be like, oh, they've taken like 6 showers today in the hospital, but that's why, because it actually relieves their nausea. We do supportive treatment, but there's some other treatments as well. Interestingly enough, capsaicin cream works well, and then our typical medications that we use for nausea in the hospital. And then we have to address the withdrawal symptoms, because it's hard enough to keep a teenager in the hospital, but if they're going through nicotine or marijuana withdrawal, then it's even harder, because they're getting some of these symptoms that you'll see, so irritability, restlessness, anxiety, increased depression, inattention, and we've had a lot of patients where they're still on oxygen and they're just trying to get out of the hospital as hard as they can, and it's just not safe. So trying to address some of these effects as well. So what do we have? The nicotine patch is available. As long as you're under 18 years old, you'll still need a prescription. So you have to see a doctor for that. And then that's a long-acting agent. You'll still have some breakthrough cravings for nicotine. So you're looking at giving them options such as gums, nasal sprays, lozenges, inhalers. Gums have looked to have been the most effective for adolescents. And then for marijuana, you kind of get some of the same symptoms, but then you're also looking at sweating, loss of appetite, more abdominal cramps as you're coming off of the marijuana as well. So then we do have a marijuana withdrawal checklist, and depending on how severe their symptoms are, you can either do supportive care for a mild withdrawal versus moderate to severe, which we do have some medications that are shown in adults to be effective to try to keep them from going back to using marijuana.
So much helpful information and insight so far. Thank you, Dr. Gibson, but we're welcoming Dr. Livingston now to the podium.
Good evening. Thanks for being here. This is very important. We're in an epidemic. I know coronavirus is getting a lot of attention now in the news, but why isn't vaping? I mean, it's affecting a lot more Americans than coronavirus. Why is that? We're just seeing the tip of the iceberg. So my job is to kind of go a little bit through, what these kids are inhaling, and then I'm going to go through and what that does to the lungs. Then I'm going to talk about a couple case histories and show you some pictures of what's happening in the lungs. Okay, you guys okay with that? Okay, let's make it happen. So. They were just talking about what they put in here. It's all this e-juice. And a lot of these kids now are just mixing in their own bathtubs, really. We've seen a couple cases where they're putting everything they can into this stuff to try to whatever. And it's mainly the flavorings that they're really trying to get in there, along with the THC and some nicotine. But really the kids are driven by the THC inhalation more than anything else. So, like we're talking, and then there's heavy metals. We're going to see in the next slide. So this the stuff that they can put in here. It's all these different type of heavy metals, xylene, toluene. I mean, you look at this list, right? It looks like a chemistry set, and that's what they're putting in here. So, the whole idea of this is to try to get it into their lungs. So you have to aerosolize stuff down to less than a micron, like 0.5 micron, to get to the small airways where blood diffusion happens, that this stuff can get in your bloodstream. So you have all these small things and these preservatives to try to get these chemicals aerosolized to the small lungs. So that's why you have all these different type of stuff that can all cause damage to the lungs. We're going to see in a little bit. So the most important thing is these diacetyls, or these flavorings. And this is, we're going to see on the next slide, called popcorn lung. So this came out a couple decades ago in popcorn factories, actually in Missouri. So the workers were putting these flavoring to popcorn, right? Everybody likes their flavored popcorn, right? Buttered and whatever else. So this diacetyl actually delivers the flavoring. So what they saw in these workers, they were starting to get short of breath, coughing, dyspnea. Several of them got admitted to the hospital. Several actually went on to lung transplants because of the severe damage to their lungs from this chemical. So the same thing is what these kids are putting in to these vaping solutions. Well, along as a thing called vitamin E acetate, you probably have heard about that. That's the same kind of thing, causes flavoring, causes this inflammation, or we call popcorn lung. So what happens in the lung? This is the diacetyl you can see on the right side. You see a little cartoon of the lungs here with the airway and then the alveoli where gas exchange occurs, and where these chemicals are trying to get to in order to get in the bloodstream to have effect on the brain and things like that we were just talking about. So, and then when they come down these small airways, they cause the inflammation. They impact these small airways and cause the airways to become inflamed. Just like you would cut your hand, the same thing happens in small airways. So when these small airways then get inflamed and plugged up, that's when the gas exchange occurs, problems, where they become low oxygen, we call hypoxic. They can't get carbon dioxide out of their lungs. They become hypercapnic, and that's what puts them in the hospital, in the critical care units. They get tubes down their throats and become mechanical ventilation. Luckily, in our hospital, we haven't seen any kids go on to have severe, where they've actually succumbed to their lung disease or gone on to lung transplantation. But that's going to occur to us if this keeps going. So I'm glad you're all here to try to stop this right now, okay? So let's look at a couple pictures. This is a 14-year-old male from St. Cloud who presented with kind of shortness of breath, coughing in the emergency room. Parents thought maybe he had a cold or maybe an asthma attack. He had some asthma when he was a toddler, but nothing recently. Came in, oxygen saturation is normal, is greater than 95. His was in the 85 to 82% range. He was breathing, normal breathing is like 18. He was breathing 30 to 40 when he came in. Got in the middle hospital. His lung disease progressed. He was in for over a week in the hospital before he got some anti-inflammatory medications, okay? So 14, St. Cloud. This is a 16-year-old from Sanford. So the lungs are, and this is an x-ray where the heart's in the middle down there. And then the lungs are supposed to be nice and black because they're supposed to be full of air. This is all inflammation in the lungs and abnormality. So it's not supposed to be there, okay? But came in to the ER. They thought maybe he had a bronchitis or a little viral thing. Well, then they ended up doing a blood gas and a pulse ox. His stats were less than 80%. I guess we were talking less. They're supposed to be greater than 90. He progressed and went in the hospital, ended up in the intensive care unit because his lung disease progressed. He was intubated and ventilated for about 3 days. Was in the hospital for another week after that, and we still see him in clinic, and he's still having a lot of shortness of breath. And again, he claimed that, he's only vaped a couple times. And we've seen that where kids, at least they're telling the truth, we don't know. They could vape once and end up in this situation, or they can be vaping for months. And a lot of them won't tell you actually what they're doing, especially in front of their parents. You've got to be inquisitive. We've done urine testing for THC, and usually when THC becomes positive, that's when the real story comes out. So it's tough. And these ERs are struggling because these kids come in with kind of these mild respiratory symptoms, and they really don't know going on, and nobody's really telling the truth and know the history. This is a 17-year-old male that from Boone High School, actually, who, again, came in with a couple months' history of kind of increasing cough, shortness of breath, presents to the hospital. And, again, his heart's right here, his lungs left and right, are full of this inflammation. It comes in hypoxic, gets in the ICU, in the hospital for 2 or 3 weeks. Okay. Then we've seen other kids, as Gift was mentioning, that have progressed so much they end up with pneumothoraxes. They're in their chest. I have a couple of kids that are still very short of breath. They can't even go to school yet because they have so much lung disease and so short of breath, and they get one little viral infection on top of this, they're going to be back in the hospital in the ICU. Okay. This is now a CAT scan of that same kid we saw before. So sometimes the x-ray doesn't tell the whole picture. This is a cross-section of the chest. This is the heart here. It's back vertebrae. This is left and right lung. So again, this is supposed to be all black because it's supposed to be full of air. It has all this lung disease, especially in the small airways. So how does oxygen get in there and carbon dioxide out? It can't. That's why they end up in the hospital in the ICU. And this is going to increase dramatically if this vaping continues. It's happening. I'm sorry. Another CAT scan of another kid, very similar, in the ICU. I mean, this thing can go very easily. They can go on to fibrosed lungs and lung transplant and even death, okay? It's not good. So once they get out of the hospital, you know, we have them come in monthly. We do a pulmonary function test to see how their lung disease is progressing. If they have significant lung disease, we're going up on anti-inflammatory measures, especially like steroids. It's the only treatment right now. And then we do things like this, where we put them in a little box, a space capsule, have them breathe. Kids love that. We measure a thing called diffusion of carbon monoxide that kind of measures the diffusion across those alveoli to see if their lung disease is resolving. So, in summary, we have an epidemic. The CDC came out with a new disease called EVALI, e-cigarette vaping associated lung injury. First time the CDC's coming out with a new lung disease in a long time, actually. So it's called EVALI now. That's what we call it, acute lung injury or bronchiolitis obliterans. Okay, thank you.
Thanks so much to Dr. Livingston and all of our medical professionals here for this insightful information that you've shared. Of course, now we want to turn this into a conversation. That's why you all are here. So we're able to, oh, I'm sorry. We've got a little more of the presentation, actually. Thank you so much, Dr. Gordon.
Get twice the price. But so, you know, we've given you all of this information, and one of the things that we want to kind of now leave you with is not just, you know, this doom and gloom information, but what can you actually do with this information to kind of help teens and young people. So I always say it all begins with a conversation. So all of this information we've shared, a lot of this is meaningful information to adults. As someone who sees teenagers all day long, including some patients who have been hospitalized for EVALI and follow-up, they're not impressed by all of this. Sometimes they don't recognize that it's related to their vaping. And that's because, you know, we have to have conversations with young people, and we have to have conversations with them about the whyness of what we tell them not to do. So teens got the message loud and clear: do not smoke, cigarettes are bad. They didn't get the message of why we didn't want them to smoke, so the things that are in it, the harm that it causes. So how do you vape-proof your teen? So, you know, as Dr. Livingston pointed out, there are things on the news that are getting a lot of attention, and, you know, the vaping epidemic is not one of them. And additionally, a lot of teens, the number of teens that I come into my office and tell me, oh yeah, I've never heard anything about this. I didn't know that vaping could kill you. You know, it speaks to the fact that although it's an epidemic as adults recognize it, it's not an epidemic as teens recognize it. So the first thing you want to do is you want to set the expectation for your teen that you do not want them to vape. I think most parents set very clear expectations for their young people that they do not want them using substances. But when you're setting this expectation, you know, teens expect us to tell them no, no, no. And so they kind of, okay, yeah, another adult told me no. But what you really want to do when you're setting that expectation is you want to say, you know, I was at this talk, or I heard this thing on the news, or I've been really worried about the fact that young people are doing this. Do you know anybody who's doing this? Who do you know that might be doing this? They're going to tell you it's some other kid at school, their friends, whatever. It's not going to be anybody it's not going to be them or anybody that you know closely. And say to them, you know, I'm really worried about young people who are having this happen to them. I want you to understand I do not want you to do this because I don't want you to end up in the hospital. I don't want you to end up with a tube down your throat. I don't want you to die or get a lung transplant. Now, teens still are not always receptive to this because teens believe frequently in what we call a personal fable in medicine. So all of these bad things that are going to happen, they're going to happen to everybody else, but not me. And so you want to continue to have this conversation repeatedly. It's something that needs to come up. The car is a great place to have conversations because you're both trapped. And so you want to stay engaged with the teen, you want to know who their friends are, and you want to know the parents of their friends. So there's a school of thought that says that, exposing young people to risk in a controlled environment where there are parents around is safer because the adults can supervise. There's very good evidence medically that that is not true. So you want to make sure that the parents of your teen's friends, or the parents that are going to be supervising, or the adults that are going to be supervising, share similar values in terms of how they want to raise teenagers as you. You want your teen to promote things that we call positive youth development. So emphasizing their strengths. You're really good at sports. You're really good, you're really creative. I don't want you to be engaged in these kinds of things because it's going to impact your creativity. It's going to impact your brilliant mind. It's going to impact how you play sports. We want to involve teens in extracurricular activities. I become so frustrated when, I ask young people these days, I feel like I'm getting old, and I say, well, what do you do after school? And everybody's like, nothing. Oh, I've already gotten to college. Oh, I don't need that for my application. Well, that's not the reason that young people are involved in extracurricular activities. Extracurricular activities teach leadership skills. They teach teamwork. They give teens something to be proud of. They teach them how to get along with others. They teach them a new skill. They teach them how to succeed and how to fail. These are important life lessons. And when you do these kinds of things, your teen will not turn to things like substances as an outlet. Finally, we want to think about ways to make it difficult. So be aware of where they are on social media. Because again, what you click on is what sends other things in. So if you're looking at their social media, you have a good sense of what it is that they may be interested in or getting input in. And then finally, limiting access to disposable income. We live in a world where you have a cell phone, you have ways to get in contact with an adult very quickly, and if you needed money to get you out of a bind, those adults can get money to whoever needs to have it quickly to get you out of a bind. There is no reason for a teen to be walking around with $20 in their pocket. When you give a teen $20, that's $20 to spend money on whatever they feel like. How many people as adults have $20 just to spend on whatever you feel like? Most of us don't. It's allocated to things that are important. And so, again, it's access. So then that's why, okay, I've got some money. I can go buy some juice for my e-cigarette. I can buy a disposable vape pen. So being really careful about those things are all good ways to vape-proof your teen. So when we talk about, what are the high yield questions, I think Dr. Kambasat talked a lot about those, but you can use some of those same questions as well when you're talking to your teen about vaping, because again, more than one conversation. So I always ask the question, why? So when a young person tells me that they're vaping or they're using e-cigarettes or juuling, I ask them, why did you start and why do you continue to? And they're always floored by that question because what they expect me to tell them as an adult is, you shouldn't do that, stop. I might eventually tell them that, but the first question is why? Because when you see, they're not expecting that question. And I'll say to them, somebody told you smoking was bad for you, right? And so now we can have a conversation about, I don't sleep well at night. I'm feeling lonely. I'm depressed. I'm really worried that I'm not doing well in my classes. I feel very overwhelmed. And when you understand those things that are going on, you can then think about, how are we going to get them to stop from stopping to use those substances again? If you just tell them to stop, all they'll do is figure out a way not to get caught. And that's not what we actually want. Then all of the important questions around safety. So when people are using, we want to make sure that we understand the safety issues around that. So what type of vaping are they using? What type of brand of vaping device are they using? Where are they getting their cartridges from? How much do they spend? And how long does it last? That gives you a sense of quantity. So when you say to a teen, how often? Not that much. Okay, not that much like a cartridge lasts you for a week, not that much like a cartridge lasts you for a few hours, not that much a cartridge lasts you for a day. Always something really absurd, something that I hope, and something that, is probably somewhere closer to the truth. And then finally, do you want to quit and do you need help? Because again, we want to give that invitation that it may be difficult to do and that it's okay to need help to get there. A lot of times teens get themselves into messes and they try to figure out how they can get themselves out of the messes on their own, and they need adults to help them. So your young person has told you that they're vaping, they're interested in quitting, and you want to get them some help. I like this slide because what it shows us is that unfortunately, only 10% of young people get help from medical professionals or substance abuse counselors. Unfortunately, almost half of them get help from the criminal justice system. We don't want that to be where our young people are getting help from. So we want to empower you with better resources than that because we don't want it to escalate to that level. So if your teen needs help quitting, your primary care doctor is a great place to start. If they can't help you directly, they can get you to other people who can. An adolescent medicine specialist, we're little rare gems, but we do exist. You have at least 3 here in Orlando. So, those are people who can kind of, again, we have extra time. We have expertise in counseling teens and figuring out how the teen brain works. Mental health professional, again, to deal with some of those underlying issues. School guidance counselor is another great connection for people who maybe can't get into mental health or feel that there's some stigma around that initially. And then finally, there are a lot of virtual and online resources. So these are great sources for education around vaping, things to help prevent young people from starting vaping. But if you have a young person who's now ready to quit, then there's also these good teen-based resources. So the Truth Campaign has been around since I myself was a tween, and they have changed, they've changed what they're doing with the times, and that's awesome. So that's a great way to kind of, they have these items on, Ditch a Jewel, so you can text it and get tips. Teensmokefree.gov is another great place, and they have an app as well. And then finally, My Quit My Life gained a lot of traction with teenagers as well. Just again, thinking through peer counseling, positive reasons to quit, how to cut back on what your use is. And so now I think we're ready for some community engagement.
Thank you, Dr. Gordon, and now we can thank all of you, Dr. Gordon, Dr. Kimson-Button, and Dr. Livingston, for sharing your expertise with us here tonight. I especially like that tip about the car conversation. I feel like that could really work well in a lot of different areas. But here in the chambers tonight, it's an open and safe place to have this conversation. We're encouraging everyone to ask questions. The whole panel is open here, as well as Shane and Shanil. So I know some of you have cards. I can help kind of ask and facilitate those questions being answered, but everybody's got the floor tonight. So let's start with some questions. Let's start this conversation. Who's got something that's on their mind? Okay. You have cards if you want to ask them? Yeah, that would be great. So our first question is, if vaping is a bad item, why can't the government stop selling this product? Dr. Livingston?
Well, that is a great question. I don't think people have got out there and really pounded down some doors to make that happen, I think, just it took a while for tobacco to be impacted, even though we knew a lot of science for several years. And the same thing's happening now. There's a lot of science coming out about vaping, and both in the basic science world and the clinical science. I think as that starts to explode more, and more word gets out, I think, and people like you all starts asking questions and get your legislators involved. I think that's what it's going to take. I think there's a lot of money to be had from this, a monetary gain. So there's a lot of pressure from the other way. And that's not totally my expertise, but I think there's a lot of lobbyists going the other way and not making us make good decisions right now. So I think it's the general public that has to get out there and I think inform our legislators how to make this happen. Okay.
I know that in November there was a lot of legislation when this thing was first sensationalized to get rid of the flavorings nationally, and then towards the end of November that kind of faded, and a lot of the response was from the vendors of nicotine vape shops that were saying that if you get rid of flavorings, it's going to kind of tank our industry. So that got a lot of attention nationally, and then that's how the ban on flavorings nationally got pushed down. So that's something where the AAP, the American Academy of Pediatrics, pushed back on pretty hard, and other health professionals as well. But that's how that happened. And the fact that a lot of the vaping illnesses now seem to be related more to the THC than the nicotine. So that was more of the argument from the vape shops, that in states where it's only nicotine vaping, then what is the concern? Like, what is the concern really that significant?
And the other thing I would add also is that, a lot of times we think, well, we have to wait for federal bans, but state law can always be more stringent than the federal law. So there are states that have already banned flavoring, but Florida is not one of them. So that means that each of us in this room, as people who are potentially Florida voters, we have, the opportunity to, more so do work within our local community and to ask our state legislators to do something about this, because it's taking a while to happen nationally.
Thank you, doctors. I want to bring in our members of SWAT. Can you tell us what is SWAT? Tell us a little bit about what you guys do on your campus of Evans High School.
Students Working Against Tobacco is a statewide program, but through Orange County we have many different subgroups in schools and churches and community centers. And what we do is we work to educate and equip our community on the harmful effects of tobacco. And with that information, we hope that our community can make a more informed decision of what tobacco is doing to their bodies.
Shane, what got you interested, you and your sister, in kind of taking this up?
Well, at first, it was just kind of because we needed hours, but we saw that we could actually make a change in the community, so we jumped at the opportunity. And through our faith-based group, we were able to join, and we've been a part of SWAT since 6th grade, about like 5 years and counting. And we've learned a lot from it, like public speaking, like we're doing right now, kind of, and then doing presentations at different places and just going around and spreading information overall.
There's a question here, and maybe you guys can answer it. Maybe our doctors can weigh in as well. But the question is, what's going on in schools? Are teachers prepared to talk about this? Have you heard teachers talk about this? Have you heard administrators talk about it?
I have heard some administrators talk about it, especially concerning the kids that they have seen who have been caught doing these things. And I think they are trying to work with it. There are punishments there are consequences for vaping on campus and things like that. And I think they are trying to work out how to approach the situation, but I don't think they have the information to do so.
So I know that Nemours has reached out to local high schools and middle schools, and we have been giving talks there. So that's always an option.
And then I was going to say that Catch My Breath is actually a great curriculum for schools to use. It has modules that's set up into different modules that are about 20 minutes long, so it can be done in health class or in a science class. So that's a great resource as well.
What kind of goes into the talk? If you are invited to a school, what will kids in classes hear?
So I haven't personally given one. I know that a lot of times it's in coordination with a health education class or a school nurse, and they help us tailor the talks.
Fantastic.
Mm-hmm. So I was going to say, I've given a few of them. Mm-hmm. And, it's a lot of times talking about kind of, the whyness of it again, why this is harmful, why these are not good options for dealing with the problems that it may be causing, and then, again, what to do if you want to quit, where to get some help in that sense.
We've got another question from the crowd here. What is the impact of vaping on pregnancy?
So, we don't have the studies to tell us because, of course, anything that is not approved by the FDA means that we don't do all of those studies. So we can't tell you exactly what the impact is, but we do have lots of evidence on the impact of marijuana as well as nicotine on pregnancies. It's not good. Low birth weight babies, early labor, babies that may be born jittery or not necessarily dependent on nicotine or THC, but definitely babies that are having some mental distress because of withdrawing from these substances. So we know that that's not a good thing. Anything that could potentially compromise your lung function is going to be a problem during pregnancy because pregnancy also decreases the amount of room that you have to breathe. So, and the baby is dependent upon the mom for everything that it gets. And so all of those harmful chemicals that Dr. Livingston pointed out, that baby is also receiving, and we don't know what the effects of those chemicals on a developing baby are.
Thank you, Dr. Gordon. Our next question is, how would you suggest stopping if everyone in public schools is flooded with nicotine devices from other children? I think we went over some of the messaging to kids, but if we can maybe go in a little more depth.
Well, I think, just like I think we have with tobacco smoking, right, is you got to educate them on the harmful effects. I think visuals help a lot. X-rays, CAT scans. Saw a great display of lungs on tobacco out there, but we need lungs on vaping out there. That'd be great. I think just visuals really impact kids more than anything else.
Just information. A lot of the patients that we get admitted to the hospital, they're just incredulous. They don't know anything about the effects of vaping. I had one patient that as soon as we told him, all this lung disease, all his symptoms could be associated with vaping, he started getting online. He's like, why is the government not regulating this? It has to be safe because this is sold in my corner 7-Eleven. So he just was disbelieving that this was even a possibility, and it's a reoccurring conversation that I end up having with a lot of these patients once we come up with this diagnosis, and then they want more information.
I would also argue that making it safe not to do these things. So yes, a lot of young people are doing this, but a third of young people are doing it. That means 2/3 of young people are not doing it. So I think emphasizing that and also pointing out that it is okay not to vape, it's okay not to. So all of that peer education, we know that peer education is actually the most powerful method for changing youth behavior. So that's why I'm excited about these young people who are doing the SWAT, who are working with SWAT. And, we need more groups on more of the campuses because peer education has been the thing that's actually been most proven to be effective in positive youth development and changing risk-taking behaviors.
Thanks, Dr. Gordon. For our next question, let's go to Dr. Hall.
So, can you speak about motivational interviewing and pediatrics? Because I think it's important. We've talked about a lot of things tonight that are stigmatized behaviors, vaping marijuana, probably difficult conversations for both parents and physicians to have. And so I know at Nemours that motivational interviewing is something that's really important to your practice. And so I was hoping you could share that.
So motivational interviewing is what I do every day in my office. And so that is actually some of those questions that I propose to parents when you get that is exactly motivational interviewing. So it sounds really fancy, but it's literally asking someone why they're doing it, what do they think are the benefits, what do they think are the risks. When they give you an excuse as to why they can't stop doing that, kind of challenging that a little bit, and really helping them come up with a reason that's personal to them that they're going to change their behavior. Again, the personal fable is really big amongst teenagers. So a lot of times, well, I'm not going to be the person with this issue. I'm not going to have popcorn lungs. I'm not going to end up intubated. I know all of these people who vaped, but only 10 of them ended up in the hospital. And so instead, thinking through, okay, so what if you're one of those 10? Okay, well, let's think about another personal reason. What if you got caught? What if, how are you spending your money? So sometimes that's where I start with teens. Okay, so how much money do you have in your pocket every day? How much are you spending on vaping every month? What could you do with that $25 instead? And so that sometimes is actually a bigger motivator than you're going to get really sick because, again, the teen frequently thinks it's not going to happen to me.
So are there some specific strategies, I'm thinking the acronym ORS, that parents can leave here tonight, so very simply with some strategies they can take home and actually use. The first of which isn't, don't do that, it's bad. I'm sure Mr. Mackey has said that over and over again, and what we need to hear is some of those strategies on how to have that conversation. So, I'm okay. I teach this, so I'm certainly okay talking about that. But I know that this is something that you have a great interest in as well.
True, but I'll let you go through the ORS acronym just because.
So one of the things that when you're having a conversation with a young person or a spouse or anybody that there might be a conflict with, you want to use an open-ended question, and it's really kind of simple. So tell me about that. When you use closed-ended questions that leave yes or no answers, then that shuts down the conversation. and people get stuck. And so an open-ended question is like the 408 in non-rush hour. And so what you don't want is that closed question where that's an off-ramp and there's nowhere to go from there. Another thing that's really important is to affirm behavior. So it's not just an open-ended question, but what can you do to affirm the worth of this person you're talking to? So it's so they're primed to hear something positive, and then the next piece is reframing and summarization. So what I heard you say is, so let's talk about a plan. And so those are, ors. That's something that you can take home and remember the next time you experience a difficult conversation with someone. And feel free to ask questions. We don't have to just have cards.
Good evening. I have heard that even in the pre-adolescent population, they're starting to use the vaping devices. As a parent, when we were adolescent or pre-adolescent, if we were around somebody that smoked, we'd come home, you could smell it on our clothes, and mom or dad would immediately know. So before a child shows physical signs where, the GI symptoms where they end up in the hospital or, urgent care, I know it's a vape, so can you smell it on their clothes? I know that you showed the picture, they're USB devices, they look like mouses. So as a parent, how can we try to prevent this when it's in the beginning stages, not when the child has already physical symptoms and has been affected by it?
So I think one of the big challenges is that it doesn't show up on your clothes. You don't have a smell in that way. And that's why I really emphasize kind of checking social media, keep limiting money and taking account of that. So for a variety of risk behaviors, because that's what I ask about all day long for a living, I'm surprised by the number of teens who get Amazon packages delivered to their home that no one opens. So, and it's because we live on this world where, there's Prime, everything's tied to your credit or debit card. Some teens are probably very unhappy that I've outed them. And so, they order things and they have it delivered to their home and they open the package before their parents ever get home and see it, and the parents have no idea what was in that package. The reality is that, you should be checking your Amazon account or any of the other kind of electronic things that are attached to your debit card. It's tedious, but that's where you get the clues. Teens are sometimes not always forthcoming in thinking, so I've had numbers of teens who've gotten busted because they threw away their packaging in the regular trash, and they don't empty their own trash. But for the teen who's a little savvier than that, that's how you find out. Again, limiting the amount of money and there having to be some accounting for it. So it's not you get $20 every week or whatever. It's okay, I gave you $20. How much did you spend this week? What did you spend it on? And then, okay, so, you only need $5 more. And so, again, we've gotten a lot of convenience, we've gotten a lot of technology, and it's a good thing, but it still requires those parental breaks, because that's really going to be the case for, particularly for these vaping devices.
Thanks, Dr. Gordon. We've got a question over here, so let's start with, let's go there.
Yeah, so I think one of the things that you have to realize is that these companies are actually they're subsidiaries of the same companies that were part of Big Tobacco. So Philip J. Morris, and so forth. So they have huge amounts of money before they're going to go bankrupt. Also, there are a lot of international pop-ups. And so again, with the internet, one of the big challenges was that since this is not a drug delivery system, that's not how it's classified, then it can be shipped internationally the same way that you can ship China internationally. So, we need some teeth around some of that legislation, so, to prevent those kinds of things from happening. There is some of that teeth being put into place on the federal level, but literally for every new type of device, and there are tons of them out there, so there are these wristbands now that, you can basically vape through. So that's a new device that requires that has a new patent. So when you write a law to ban it, you ban Juul, you ban a single-use e-cigarette cartridge. You didn't ban the new little wrist device. And so this is the issue in terms of we need kind of legislation that's much more broad and more blanketed in order to be. So from what I've seen, sales have been steady. The sales have not plummeted from this. Yeah.
That's terrible.
It is.
You can also go on YouTube, which is what I've seen some of my patients talk about, and it tells you how to make your own juice at home. So it's not even that we're afraid that you're going to go buy it at the corner store. It's more scary when you mix it yourself and then you don't even know what they're putting into it as and then if you're getting it off of the black market, the vitamin E acetate was used to cut the juice to make it a larger volume so they could sell more of it. So it's even the off-market stuff. It's not even the market stuff that's the huge concern.
Wow. A lot of the questions that we're getting are centered around. Okay, we're gonna go here.
Dr. Livingston has made it quite clear that we are facing an epidemic.
Mm-hmm.
At what point does this epidemic actually get addressed at a national level, where they really do something about it? Because as parents of a child who's been through something like this, extremely so, I can tell you that I'm not happy with what I'm hearing or seeing in terms of how this is being policed. And when there's an epidemic involved, if you were to mess up Tylenol, they take that off the shelf. Why are they leaving this stuff on the shelf like this when we know it is dangerous?
And I think that's why our doctors are here, because they're trying to get this message out.
I think the
Right,
pushback
exactly.
is that they haven't been able to isolate it a specific brand or a specific brand or pen or a specific brand of e-juice. So then until you can say this is the specific manufacturer, this is exactly what happened to it, I think it's going to be very hard, on a government level to get it out.
Yeah, I mean, it's $1 million question, right? So, I mean, why isn't it being talked about nationally, Like I mentioned earlier, I mean, we got many more Americans, like 60 deaths throughout the country because of this stuff, directly related. Yeah, exactly. And it's increasing dramatically, exponentially, So why isn't it on the national level? I don't know, Somebody's suppressing it for some reason, right? So.
Thank you. A lot of the questions seem to be centered around having this conversation with kids. There's obviously some trepidation here about parents having this conversation with their kids. So I want to bring our teens in. We have some very special insight here. So Shane and Chenille, some of these questions are just how should parents go about talking with their kids? What do you guys think about how parents should start this conversation?
Well, I think the car conversation was a good point that was brought up, because sometimes it's just teens don't want to necessarily talk to their parents about all issues because they're afraid that the parents are going to get all in their business. So I think that car conversations would be a good way to bring it up, and like they said, open-ended questions. Because if you ask somebody if they smoke or vape or something like that, they're probably just gonna say no and then shrug it off. And then at that point, there's nothing you could do. You can't be come back here, because they're already gone. So, yeah.
And on that vein that we just spoke about with big tobacco, do you feel like these companies are targeting youth and your friends?
Well, yeah, I'd say they're targeting us because the older generation is dying off due to all these illnesses and diseases that smoking has caused. So they need the new smokers. That's why they're bringing in all of the vaping products, because, as you know, vaping is very addictive. And then it was originally used in order to stop the amount of smokers, but it came a fad in itself, and we're seeing a lot more vaping than smoking these days.
Chenille, have you been looking into the different ways that young people are being targeted?
Yes, especially because of the packaging itself. You see a lot of advertisements where it looks like these people are happy doing using these products, and the products that they're using, the packaging is very colorful and bright, and even the flavors that was mentioned that would appeal to more younger kids. They don't want to smoke something or that is just regular plain. They want something that has flavor, that appeals to their taste buds. And even the prices of these things, like something that you can get cheaper, very cheap, and easily buy.
Yeah. What are you doing at school to educate your peers?
I think it's just giving them the information. Like when I hear it from these type of events, and when we go out to different places and we speak with our advisors, and they give us more information about what has been coming out about these things, we just let them know. And especially if you see somebody doing it, it's just one of those things where like you feel sorry for them because they don't know what they're doing to their bodies.
Yeah, absolutely. Before we go back to the cards, we've got another question.
Since Ivale is only about 6 months old, would it be fair to ask or to share with someone who is vaping and who won't give it up to possibly use some of the product that has been out for years that hasn't been causing Ivale, like the blue products or e-cigarettes that have been around a long time and haven't caused this Ivale problem? Should they possibly be recommended to use that if they're not going to give it up, for example?
Well, a lot of those products have, you're talking about the adolescent population, right?
The products that have been on the market for 20 years,
Right.
e-cigarette products like Blue have been around for a long time, but they have not caused Ivale. The new vaping products have. So my thought is possibly that we recommend, if they're not going to stop, at least try something that is tried and hasn't been causing this extreme lung injury.
Right. So all those e-cigarettes are designed to deliver nicotine.
Of course.
So all these Ivale issues are mainly around THC. So, and it's all the flavoring, right, that's caused a lot of this. We talked about the lung damage earlier, right? So the e-cigarettes don't have the flavoring in them, where the vaping products do per se. So, plus, I know we haven't seen like the bronchiolitis obliterans with the e-cigarette products, but long term, we don't know what that's going to do to people's lungs, because you got a lot of, we talked about earlier, all those chemicals are in those e-cigarette products that are could be carcinogenic too. So we don't know because it hasn't been out for long enough. But I would bet you're going to see, just like you see with smokers, once you get over 10 pack years, your risk for lung cancer goes up exponentially. So I expect that's going to happen with e-cigarettes. So I don't know if I'm going around on that question a little bit. I guess e-cigarettes might be a little bit safer than Ivale just because they haven't been as safe, but I think long term they're not safe either, most likely too. So.
Thanks, Dr. Livingston.
And I agree, but just going back to those CDC recommendations for the public, there's no recommendation now to stop e-cigarette use. But again, like my personal recommendation, and I think the panel up here would be, if you are using it, then why are you going to put yourself at risk? But right now, there's not a specific recommendation to stop. If you're using e-cigarettes, don't go back to cigarettes is one of the recommendations.
All right, we've got another question from the crowd.
My name is Captain Tassi. I'm with the Florida National Guard Civil Operations. So we have a prevention education for middle and high school related to drug abuse and drug prevention. Vaping has been a big problem. At the end of one of my presentations, I had a teenager come up to me, and he was very concerned about secondhand smoke. So for the doctors, is there bad effect on secondhand users? And then for the teenagers, do you see that a lot? Are you concerned too? Are you concerned?
There's actually a new paper that's out in the Journal of the American Medical Association. I think it just came out recently. I just got an email this afternoon that's saying now 1 in 3 teens are exposed to secondhand vaping. So even though you have like a quarter or a third of teens that are actively vaping, then you have a third of teens that are exposed. There's not a lot of data about secondhand exposure to e-cigarettes at this point, just because it's such a new entity.
Yeah,
but it does increase the chances of them, if they haven't smoked, I haven't read the whole article, but if they've never smoked, to then go on to smoking if they've been exposed to secondhand.
And, we don't really understand why some individuals have had this popcorn lung or bronchiolitis obliterans, right? Tons of kids are doing this vaping. Why we're only seeing a small percentage of those. I think that's going to increase dramatically in the future, but it's probably based on genetics. So if you have a certain genotype, you're going to be more susceptible to developing this bronchiolitis obliterans versus somebody that doesn't. So all of a sudden you have the right genotype and get exposed to secondhand smoke, you're going to be sensitive even though it's secondhand versus if you just have the wrong phenotype, basically. So it's going to be a problem. We're going to see more of that coming up, I'm sure.
I'll talk about it. Okay, so so we have Not a Lab Rat Day in October, and that's dedicated to informing all the youth not to be a lab rat, basically, because we don't know all the effects on smoking. Actually, it's vaping, the e-cigarettes, and we just try to make them or push them to change within their communities and allow them to learn more about all the effects.
Great. Don't be the lab rats. That's a good. Yeah, that's a good message. On that vein that we were talking about with secondhand, one of the other questions that we got here, and I think Dr. Livingston, you went over this or you touched on it a little bit, so maybe if you could expound on it, about someone who refuses to stop. Someone is asking here, would it be beneficial for them to sort of curtail or at least cut down on their vaping?
Well, again, I just touched that a little bit on the genetics, right? So if you have the wrong genetics, just a little bit of vaping, and we've seen that. Maybe kids have only done once or twice, they're in the hospital, right? Or kids have done it for a year now or more and not having an effect. So it's just based on your genetics. We just recommend everybody not to be vaping, that's all. So.
Anybody from the crowd? We've got one over here.
I think everything that we are saying here are all good, but the main thing is, one question is, will the kids listen to you, parents? That's the main question. The reason that I say that is because I think the government did something wrong when they give the privilege to the kids and took it out from us, parents, and the teachers. So when the kids already know that they can do whatever they can do and the parents cannot do anything on them, then that's the time that the parents, it's very hard to handle now. If that's not the way now, if we parents and the teachers have still the privilege, these things will be, if not stopped, will be minimized because the kids will listen to you, to the teachers, and to the parents. But the problem now is the kids are not listening. Yeah, you talk to them, but they're not, as if they cannot hear anything. That's the main problem. That's my, because as a grandparents and parents, that's really what I'm really seeing. Thank you.
Dr. Gordon, you mentioned a little bit about the Truth Campaign and how that kind of tries to get on the level of a young person.
So, I would, as I said, the literature does suggest that the most effective campaigns are peer-to-peer. And that is very aligned with how young people develop. So it's not anything that's new or changed. What the item that teens don't listen to their parents about is changed. But the reality is that parents since the beginning of time have always felt that their teens don't listen to them. The reality is that teens actually do listen a little bit more than we think they do. However, part of the development of adolescence is that you respect peer groups more than your parental groups. And that's actually very developmentally appropriate, because you have to test the boundaries and you have to decide what of the values I've heard are my own values that I'm going to incorporate into the rest of my life versus which are the ones that I might not want to keep. And the reality is that, it's a good thing that we have that testing process going on, because not all values that we hear in our homes are necessarily good lifelong values, or aligned with what it is that we want to do. But what we want our teens to do is to be able to take as many of the good values and carry them with them throughout life. And so it's not just one conversation, it's multiple conversations. It's, and a conversation is a two-way conversation. So those open-ended questions, kind of revisiting the subject, explain to me what you mean by that, tell me a little bit more about that, because that's actually a conversation. When teens tend not to listen is when they hear things that are mandated to them. That is very true, that teens don't tend to listen to direct orders. Quite frankly, most people don't listen to direct orders.
Another question from the crowd.
Doctor, I have a question for you. So, of the chemicals that you had listed earlier, which one, in your opinion, you think is going to be the next killer? We know that vitamin E was the culprit last time, and we kind of contained it. So, which one you think, in the long term, can have bad effects? Is it formaldehyde? Because we know it causes cancer, or which one you think?
You can pick any one you want of those on that list. They are all cancerous, carcinogenic. Again, if you have the wrong genetic makeup in the oncogene, that could be stimulated by one of those chemicals. It's going to get stimulated, and then you're going to end up with cancer. So they all can be dangerous. I think that the toluenes are probably the ones that are going to be more symptomatic for an airway in a patient. So as those chemicals probably get expanded, because obviously we're doing a lot of research on the effects of these vaping chemicals, but also on the other side there's a lot of research and development going on how to improve them, how to make them more viable, more potent in a vaping apparatus. So that's being worked on pretty extensively right now. So I think we're going to see a lot more potent kind of in the toluene type family in the future. They're probably going to cause a lot more damage. Okay.
Thanks, Dr. Livingston. We have one more question from the crowd.
So kind of what you were saying about like the peer group thing. In terms of like, especially kids with how like the YouTubers and all are such a thing. Is anything being done on either side in terms of like influencer marketing? Like, are vape companies targeting influencers to promote their product, and are companies like the website resources you were sharing doing anything on the other side to maybe partner with influencers to kind of try and stop it? Because you'll listen more to the YouTuber you follow than your mom.
So, I'm blanking on the my quit my choice, or my choice my quit. They're using YouTube influencers, definitely in that sense. The Truth Campaign has a YouTube channel, so not necessarily influencers. Unfortunately, it doesn't seem as if we have a lot of celebrities that have taken this up as their passion project. So we're not seeing influencers in that way. Definitely on the other side, there are definitely targeted YouTube campaigns, more so internationally than here domestically, because there's some regulations that make that a little bit more challenging. So, you can't put someone that's known to be a teen influencer. But definitely the way that the information, the ads are crafted, it's very much this idea of join a community, be happy, so that definitely appeals a lot to teenagers, and so and young adults, because there is a lot of isolation. Everybody's on social media, but no one has many friends in IRL, as they say. So there is definitely this longing for community, and I think that the marketing for the e-cigarette companies have really capitalized on that.
Thanks, Dr. Gordon. We have just a couple of minutes left, and I want to bring Shane and Shanil back into this. Can I ask, what can students gain from joining SWAT?
Well, besides the information that you get and all the resources that we give, we also we do public speaking, we do leadership training skills. Some of the places that we've gone to Tallahassee to speak with our legislators and representatives. We've gone to workshops, and we've gone to like SWAT camp, where we go to camp and we speak about things recently we've done with vaping and such, and we just learn more information, and we just meet a group of people who are like-minded and who have the same goals as us, and we network.
Thank you so much. All right, and one more note before we go. At the American Lung Association on Wednesday morning, the 2020 State of Tobacco Control Report will be released, and the American Lung Association is welcoming everyone there. This will be an opportunity to learn about new findings that will be released then on Wednesday. So hopefully some people here will be interested and can join in on that. But we're so glad that you were interested in joining in on this conversation. Thank you for joining us, and thank our panel here for providing this valuable insight. Thank you.
You're watching Orange TV, your government in action, a service of Orange County government.